Hello, and welcome to the Happy Half an Hour with an expert in hemophilia care. In this session, we will focus on psychosocial questions in inhibitor care. And as our guest, we have invited psychotherapist Miss Nicola Dunn from Royal Free Hospital in London. Welcome. To start us off, I would like to ask you, what is good emotional health and how we can achieve this and live positively with a chronic disease?
I'm just going to speak a little bit from my experience, and I realised that actually all the people listening are actually experts in haemophilia with inhibitors, and particularly they're an expert in their own condition. But I'm going to just share with you what I've learned from other patients who have been living with haemophilia with an inhibitor. So I would say if we're thinking about emotional health, I think actually that emotional health, the strongest emotional health, often is present and demonstrated in the people who have had to undergo the most difficult situations. So ironically, it seems that good emotional health doesn't come out of having an easy life. So I would say in its most simplest form, it's probably a combination of two things. And one is a degree of acceptance around things which it is perhaps impossible to change. And it is equally a degree of optimism about the things which might not have changed yet, but it is possible to engage with. So it's both acceptance and I would say courage to make changes both in your own life and in your own context.
People who are directly affected by inhibitor are usually boys and men, and they don't necessarily talk about their feelings and emotions. And then also their caregivers usually are so wrapped up in the care that they don't always dedicate the time for themselves and their own well-being, which means that neither of these two groups would be very prone to seeking help. What would you say, Nicola? What would be the warning signs that they should look out to see that their emotional health is being at risk? And also, maybe how could we motivate them and initiate this reflex to seek help?
Yes, so I think often, let's just say if we take even a couple, let's say we take a couple, perhaps the man has haemophilia inhibitor and his partner wife is the caregiver. I think what often happens is they're trying not to overburden and worry each other. Mm-hmm. So what happens is that the things that are going on actually don't get talked about. So each is trying to second guess the other. And sometimes it's actually can feel quite difficult to make opportunities to have deeper conversations. So I think the first step in the more creative part of that is to try and see how could you make an opportunity to have one of these conversations to actually try and find out what really is going on. Mm-hmm. Because often, I know in the UK, the population are the master of the understatement. So if you ever ask how they are, they always say they're fine. And fine sort of means not really good, but not really bad. It doesn't really mean anything. So often I might ask people, well, what kind of fine? Just because it's people need encouragement. They need encouragement to speak out. And I think some of the, as you say, what are some of the worrying signs? I guess are a sense that something is going on that's difficult, but not having a discussion about it. Mm-hmm. I think for caregivers, it can often be burnout. A sense of really forgetting to look after themselves just in the most, sort of maybe even the most minimal or basic kinds of ways, but also losing their joy in life. So I think when any of these things are happening, something needs to change. Mm-hmm. So I think the first thing is that people, it's hard to sometimes admit that something is very difficult. Mm-hmm. And perhaps someone is feeling that actually if they're, I think with things like, lowness of mood, one of the challenges is that often people really, it's not that they can identify feeling bad, it's that they don't feel anything. They feel a kind of emptiness. And I always say emptiness is a feeling. And because they can't, they find it difficult to talk about the emptiness, they're finding it difficult to actually often reach out. So often this comes, I guess the first impetus might come from someone who cares about them and notices the changes, notices that their sort of joy in life has diminished a bit. Some of the things that they enjoyed, they don't seem interested in anymore. And I speak about a couple I know I think have got a fantastic relationship. And I asked him, what are your secrets? And he says, when something is going on, and he says, in this case, when his wife will say everything's fine, he says, I persist. I don't give up.
Mm-hmm. It's a very hard work together, actually, with the one that you care about and the one that cares about you.
Yes, and it could be a family member, it could be siblings, it's whoever it is. It's just that people are keeping an eye on each other, and they are prepared to persist with a slightly uncomfortable conversation, and often one of the things is just to say to people, actually, I really think you're suffering.
Mm-hmm.
Because people feel bad, they feel guilty sometimes about not being perhaps as joyful as they feel they should be. And it's just acknowledging that actually underneath all of this, actually there's quite a lot of pain.
Yeah, that's true. There's also a kind of the pressure around to be fine, right? So
yes, exactly.
One of our listeners is asking regarding the psychosocial issues and differences between the generations when it comes to those issues. He's belonging to the older generation himself, and he says that when they were growing up, and there was a lot of ignorance around hemophilia, and also even among the healthcare professionals. So they did not tend to broadcast and discuss the fact that they had hemophilia, and also as many of them went through the 80s and the tainted blood scandal. However, he's saying that the younger generation now has this opportunity to discuss and to engage and to talk about this. And so what would be your take, Nicola, on this whole set of issues around the older generation of hemophiliacs, and when it comes to the younger generation, this whole set of issues is less heavy?
Yes, I mean, I think I'm really glad that you've sort of raised that issue. I think some of our older gentlemen, I think they had to create almost, I mean, we use the word Chinese wall, but let's say a kind of wall in which they presented a version of normality out to the world, in order to be able to work, to not create what they would consider, fear in the workplace. So they had to learn to really, in a way, have a survival sense of separation off from these sorts of things. So they got very good at that, I think. And I would also say that portion of patients are, they are very stoic. So they have really strong skills in that area, that they actually have put up with a lot of pain, a lot of difficulty, a kind of feeling that perhaps if their communities knew what they were dealing with, that they might be rejected, and nobody ever wants to feel rejected by those they work with or those they love. So they've actually dealt with a lot. But I think, so then when we are sort of saying, well, actually, hang on a minute, what's going on? Do you want to talk about it? I mean, often that's the last thing that someone who's gone through those periods really wants to do. But I guess it is about catching up a little bit with the fact that we are in different times. And sometimes even very, sort of significant survivors of those periods, they also too sometimes need a bit of support and a bit of help. And I think the divide then is kind of contrasted with our younger patients, because they haven't had to go through that. They have, I think, a different relationship with personal information and confidentiality, particularly online. And sometimes that serves them, and sometimes it gets them into very painful places. But yes, I think they have a very different experience. But I think it's really, really important that we don't forget what our older patients have gone through, and really, in a way, what skills that they have to share in our community.
We have another question that has come in, and it evolves around parenting children with inhibitors. So it has to do something with the concept of normality. And, the children, the kids, they do want to be normal. And then again, we have the parents who want the highest possible level of protection. And the question then is, how can you avoid this clash? What would be the best strategy to avoid this clash between this parent who wants to protect and the child who wants to be normal, which means also doing things that normal children do, etc., etc.?
Yes. So I think our parents are hardwired to want to protect their children. And we know that, and I think what happens, which is challenging, is that, when haemophilia is discovered, I think often parents first of all feel that somehow they must have done something wrong. They didn't protect their son from getting haemophilia. And then, of course, an inhibitor is an additional element of that. So there's an idea that they want to protect all the time and to protect more, because somehow they didn't protect enough, even though that's not actually correct, but that can be the feeling or the belief. But of course, what we know is that, and I think the word normal is very difficult. I don't consider myself normal. I don't even think I know anyone who's normal, but it's a word that we all use. But I think there are other words that might be helpful, which would be, resilient, being strong in your own way. And I guess resilience comes from often living a life where there is an element of risk that is containable, because out of a bit of risk comes growth, whether that's emotional risk or whatever it is. But I guess the risk of being yourself and the risk of sort of reaching out and rising to your potential. And I think that feels risky for anyone, and it must feel even more challenging for the inhibitor community. But I think, there's certain people we know in the community who feel that they have lived a fulfilled life. And I think this is really what we want parents to really be thinking about, that their children, their sons who are growing up, that they have a fulfilled life in their son's own terms, whatever that would be. And of course, that is very different to being protected or overprotected. Well, I think it's everything in moderation. As you say, on the one hand, it's not overprotecting children. On the other hand, it's not saying to them, there is no risk, because actually, I guess what teenagers are doing is they're learning to manage risk. And sometimes teenagers get it wrong just because it's hard to gauge that. They're in a new body, they're in a young adult's body, and everything is changing, and sometimes they get the risk wrong. So I think it's a tricky line and tricky pathway. But I think bravery is one of the elements, but I think it is having a measured response through that.
Our next question also is about parenting, and this is more linked to parenting a teenager. So our listener is a parent of a teenage boy with inhibitors, and the question is, how much of the parent's emotional well-being is it appropriate to show to this growing young person? And because there are, of course, good days and bad days, and the days when the parents are on top of everything, but there are also days when the parents are feeling miserable. So where to draw the line, what to show to this child of yours?
Yes, that's a really good point. So I think it's trying to keep it real, and at the same time, so it is, I guess what your son is then seeing is that sometimes it's hard, and there are feelings that come along with things that are hard, and then but I guess it's the most important part is he sees your recovery from that. So and he's not going to see any recovery if he doesn't see that it's hard sometimes. And I think the thing, because children are very sensitive, obviously, to their parents' feelings, I think it's you share that it's difficult, you share that you remain, there's still a strand of hopefulness. Yeah. And then the last thing is that also that you'll take care of this. if a person happens to be in a relationship as you are, that you and your husband partner will support each other and take care of it. And if a person is a single mother, that there'll be other people, hopefully either friends or family, that they will go to who support them. So it's the idea that they see the process, but they don't have to feel responsible for it. And it also then gives him permission to have a similar process. And I think you will get feedback from his face, or from, you'll get some kind of body signals, and that he might be able to take a little bit of it, but then he might be done. That might be it. And I guess the other point is that, because his dad is in the home, his father is another important role model around, men having feelings from time to time, and also recovering from things that are setbacks or are difficult.
Our next question is moving from specific caregivers such as parents to caregivers in general, and the question is what would be the best strategy to avoid the sensation of burnout in caregivers?
I think there has to be self-care. So caregivers are important, they've got an important role, but they actually can't do that role if they have burnt themselves out completely. And so I think it is, it's care to self. It's care to self and care to others. And so whatever that might be, whether and sometimes it's small things, but it's enough small things that they actually attend to their own needs, and they don't sort of always think that they can come at the end of the list. So I think that's quite hard. I mean, if I can only speak from my experience in the UK, is that I think that we have the term, which is, people often use this term, which it doesn't sit so well with me. They say, I need to be a bit selfish. It's not selfish. It's actually there's nothing selfish about it. It's a gift to the person you're caring about, looking after yourself, and it's essential. It's not selfish. And so I think it's a kind of change of mindset. And I know in the beginning that might be hard, but it's whatever it might be, it's simple little things that make a difference. And it's ensuring that your own needs are definitely not at the bottom of the pile.
The question from our next listener is quite specific as well. It's about importance of the social life components in the emotional well-being. And especially he wants to know about the age group between 40 and 50 years of life. Those would be the patients who do have small children, but also their health status is not always the best, so they would have a lot of joint pain and so on. And there they would find that one of the few elements that bring joy in life is the social component. So what would be your take on that, Nicola?
So I think it is a challenging time, as you say, because if they have families, then that's very, very sort of full on. I think belonging to communities that understand something about what you're going through, I think, is really important. Yeah. So I think people in the haemophilia and inhibitor communities, they're balancing the two things. They're balancing membership with their families and attending to that, and their extended families, but also it is important that they have contact with other people where, using this word that we say we don't like, but I'm using it again, where they feel some level of normality. They feel that they're with people who understand something about them. So I think that's important. And I know it's a tricky time for parents and people to be able to socialize very much, but I think some element of it is important. And if we're actually talking about couples, you think about all these responsibilities we're talking about, but it is a blend of socializing separately and maybe in your gender groups, men with men and women with women, but then also having enough couple time, which I think is really important, and also can be a little bit challenging when, how you earn your living and having a young family are all sort of demanding your attention. And I think you're also talking about a time of life between 40 and 50. It's midlife, and I often use the word, it's not midlife crisis, but it's midlife opportunity. It's like a figure eight, that people are sort of looking at, well, what is, what are my priorities, or how do I want my life to be a little bit for the next portion of life that I have, So I think it is a challenging time, and sort of reassessing the priorities of what actually would make an increased quality of life for that group is really, really important. Because as you say, a lot of them are actually managing pain and not talking about it, but they've got chronic pain, and that we do know is very tough on your quality of life. So I think it's, there's a lot to do, and there's a lot to do when you're an ordinary person. There's a lot to do when you're trying to manage, haemophilia with an inhibitor. You might know that you should be swimming, you might know that you need social contact, all of these things. There's a lot there, but I think it's trying to actually work out what is possible for each individual, and also there is a lot that is gained by coming together in community, either whether it's small groups or larger groups, and I really wouldn't kind of underestimate that.
So one last question that I would like to ask you, Nicola, is about how to embrace a change. Because now we are living in a time that is quite life-changing for people with haemophilia, and also those with an inhibitor. There are the new treatments becoming available that are quite that bring about quite a big change. Yet there are still some reservations among the people, and holding on to what they are used to. So, what would be your advice? How to best embrace these quite radical changes that people are facing these days?
Yes, so I can speak a little bit, because obviously I have some contact with patients who are going through the gene therapy trial at our centre, and I think and perhaps this is a function of my age, but I think it's about thinking about the middle way, that we've got a lot of new treatments coming, and it is trying to pick your way down the middle of that. So you finding yourself in a position where you have hopefulness, but you also add in a huge dollop of realism as well, just to avoid disappointment. So it's managing that swing between those two things, because it seems that you always get something, and then you always lose something a little bit. And I've seen that in some of the patients in the gene therapy trials, that any change, and oddly, even any change to something which actually technically is better, has an impact. So I think it's firstly acknowledging that it is a change, and that you may need time to really readjust, and that you may have feelings of, ecstatic feelings that things have changed, but actually other times you may feel a little bit sad for no reason whatsoever. So I think that identity is a really interesting thing, and that changing identity is a whole process. And so I would say, whatever new treatment you might be on or whatever, if you can just make a little space, potentially, that there might be some ups and downs, but that is within the range of being on new treatment, that is normal. And that all of us actually often find change a little bit challenging, because we're balancing this thing about risk and potential gain. So as you said, somebody could be on Haemophilia, but they actually feel awkward about changing a pattern that they've had for a very long time. So it's actually going to be probably what I call micro experimentation, because anything much more than that could actually bring up quite a lot of anxiety. But it's trying to get the trajectory moving in the right way, but that somehow the experiments are managed. And in gene therapy, it is becoming accustomed to the fact that someone's level has changed, and but you gain something, but you lose something. So they are very interesting, at the same time testing times.
So with these small steps, it's kind of staying still within your comfort zone, but kind of stretching it a little bit.
Yes, it is. It's what I call managed risk, and so it is. It's trying new things, but it's not swinging the pendulum madly to the other side without, any regard. But it's in other realms, sometimes they talked about stepped kind of exercise. So you're really quite clear how you're taking those steps and how you're actually stretching yourself.
I warmly thank our guest for this session, Nicola Dunn, and thank you to all of you who listened to this session. We hear you next time. Goodbye.